Hello, I'm Dr. Sarah Gomendi with Vibrant Natural Medicine, and today I'm going to be discussing thyroid lab testing. Many of my patients are told their thyroid tests are normal. However, upon reviewing their past lab work, I find most often that the only marker that's been tested for their thyroid health is TSH. And that's just not sufficient to fully assess what's going on with the thyroid. I typically run a 10-marker panel to fully assess what's going on in each step of the process so that we can correctly restore balance. So I'm going to show you an example of just this little drawing that I've done here today to give you just a little bit of a sense of what we're looking for. Okay, hopefully you can kind of see this. So up here at the top, this is that marker TSH, which is actually coming from the pituitary gland in our brain, and it's talking to our thyroid gland and telling it to make more thyroid hormone or less thyroid hormone. So that's what signals down here to make what we call T4, one of the thyroid hormones of the thyroid gland. From there, T4 actually has to be converted into T3, and then from there we've got this little fork in the road where we can make either free available T3 or reverse T3, which is an inactive form. So the thing that our cells can use is this free available T3. So it's not really helpful to only get one marker of TSH. So I kind of talk about how, we're looking at a puzzle here. If you only have one piece of the puzzle, it's hard to see the whole picture. So this is just an example of a few of the pieces that we're looking at when we do a full thyroid panel. And the other thing we want to include in there are antibodies. There are several different antibodies that can be formed against the thyroid gland. And it's really important to know if those are present or positive, because that would indicate an autoimmune condition, something like Hashimoto's, and that's one of the most common causes of hypothyroidism. And if that's going on and that's the case, then we need to not only support thyroid gland's health, but we're going to be needing to work on immune system balance, because that's going to be part of the underlying cause for those hypothyroid symptoms. All right. So another common trend I see are also patients who are already taking thyroid hormone replacement, but they still feel terrible and continue to have many of those hypothyroid symptoms, which could include things like chronic fatigue, hair thinning, difficulty losing weight, constipation, anxiety or depression, dry skin, irregular or heavy menstrual cycles, as well as brittle nails. So what do we do? Kind of like I mentioned, those standard thyroid testing methods are just not optimal and leave many people continuing to suffer with symptoms and no answers. So if you have signs of a thyroid imbalance, let's check a complete thyroid panel with those antibodies to see the full picture and be able to start the right naturopathic medicine plan to get you back to feeling your best. Please leave a comment, contact our office with questions, and